7-year-old William Lyons is a textbook class clown.
He always tries to make every situation just funny. He's just a blessing to have.
William's happy dance spreads smiles at MU Healthcare, where he's receiving treatment for a rare metabolic condition called Pompe disease.
Kids and adults that have Pompe are missing an important enzyme that helps their body break down a substance called glycogen into glucose.
Pompe disease is a genetic condition that affects 1 in 40,000 people. It causes muscle weakness that gets worse over time and can lead to heart, lung, and liver problems. Caring for kids with complex conditions like Pompe disease takes a team approach.
Thank you.
We've seen well over 30 different doctors.
Take a big breath in.
At MU Healthcare, experts check William's breathing and lung capacity. During the same visit, he sees a heart specialist. And Dr. Jane Emerson, a pediatric physical medicine and rehabilitation doctor, focuses on his mobility.
It also allows us to see them together if we need to, or to conference per se, so we can come up with the best treatment solutions.
While there is no cure for Pompe, there is a treatment to help slow its progression. William receives a weekly infusion called enzyme replacement therapy, or ERT. It's advances like these that give Mom Sheila hope.
15 years ago, there was no medication for Pompe disease at all, and now they have medicine. Maybe 5 years from now, they could cure it.
Optimistic about the future for her strong, silly boy.
From the University of Missouri, I'm Teresa Snow.